Hi, it's Dr. David Greene, CEO of the Arizona Pain Network. Today's topic is epidural steroid injections. Epidural steroid injections were invented back in the 1950s, and back then it was a fairly rudimentary procedure. There was no x-ray guidance used. The doctors would just put the injection in blindly. And as the decades went on, they actually got some better techniques for accuracy, and now it's about the most accurate as it can be because pain doctors will use what's called fluoroscopy, which is real-time injection, real-time x-ray to know exactly where the needle is being placed for the best accuracy and outcomes. So an epidural steroid injection is performed in order to relieve pain coming from a pinched nerve root. All right, let me show it to you on a model. This is looking at the front of the spine. This is looking at the back. And this is, we'll look at it from the side for a second. Basically, these are the intervertebral discs from the side, and you can see that this model has a little red piece coming out to show a herniated disc, otherwise known as a slip disc, and there's other names as well. But basically, as a nerve root comes out, this yellow thing here, here, it can be pinched by this nerve root, this piece of disc that's coming out and pinching on the nerve root. And that can lead to what's called sciatica, which can be very painful as electrical pains or numbness going down the buttock and the leg, depending on which nerve root is getting pinched. Okay? So to relieve the pain from that and help avoid people going to surgery, the epidural steroid injections are performed. Now, over the last few decades, we now have 3 different types of epidural steroid injections. So the first is almost the same as the one that was initially invented. It's called an interlaminar epidural injection. And basically, what you have here is at all these levels, you have this bone on the back of the vertebrae. It's called the lamina. These are the pieces of bone that you can feel on the back when you touch your back. That's called the spinous process. And this is a lamina, that's a lamina. And basically, the needle goes between the lamina, so it's interlaminar. So you go to the appropriate level where the disc herniation and the pinching is, and the pain doctor will be able to feel this thick tissue called ligamentum between the two. And as they get through it, they end up feeling the pressure stop, and then they know they're in the epidural space. The spinal cord stops around T12, somewhere around T11, T12, L1, and then it becomes what's called the dura. So they say epidural, meaning around the dura, around what's left of the spinal cord. You don't go into the spinal cord with the injection. You go around it, okay? So that's interlaminar. Now they have a new one called transforaminal. So the foramen is where the nerve roots come out. It's like almost like a circle where they come out, okay? So to try and get the needle closer to where the pinching is occurring, the needle goes not interlaminar, but out here, to try and get it as close as possible so that the steroid can bathe the area of pinching. The steroid's a huge anti-inflammatory. So if it can give pain relief for weeks, a few months, maybe this little piece of disc will just disintegrate. So you won't need surgery. Okay. Now the third type of epidural is called a caudal. So basically it's not really accurate on the model, but the needle goes way down into the sacrum through an area called the caudal, I think it's called the sacral hiatus. Yep. And the needle goes in, the steroid is injected and numbing medicine, and by gravity it kind of moves up and it can actually get multiple areas. Now it's good for a herniated disc, but it's better for a term called spinal stenosis. And that condition is when arthritis overgrows soft tissue and bone, and it can pinch multiple nerve roots. So that's why you would do that, is most of the time, to get pain relief at multiple levels. An epidural steroid injection is performed in an outpatient setting because you go home within about an hour after the procedure. Okay? The procedure itself takes around 30 minutes. And what happens is the pain doctor puts the needle in and then usually injects some dye to make sure the needle's accurately placed. And once satisfied, then they'll inject the numbing medicine and the steroid. The steroid takes usually a couple days to kick in, but the numbing medicine kicks in right away. And that can last anywhere from 6 to 18 hours, depending on what type of numbing medicine is used. Okay? And hopefully the pain relief will last for weeks, maybe even months. Now you can have a series of injections, one every 2 to 6 weeks to try and augment the relief that you get. And hopefully by the second or third injection, you'll be really comfortable getting back to work, being able to drive. I mean, the sciatica pain that you can have, or if it's in the neck, it's called radiculopathy down the arm, it can be really disconcerting. It can be trouble concentrating, trouble sitting, trouble, just picking up your kids, doing all kinds of things. It can be affected. So 95% of people are able to avoid surgery for a herniated disc. The good to excellent outcomes from an epidural injection are usually about 75% on average. There have been dozens of studies done. When you put them all together, it's around 75% good to excellent outcomes. So what are the risks of an epidural injection? Well, the risks are very, very low, less than 1%. There's a risk of infection, there's a risk of bleeding, there's a risk of nerve injury, there's a risk of allergy to the medication used. There was a scare a couple years ago where there was some tainted steroid coming out of a compounding pharmacy in New England, and some people got very, very sick. A couple people even died from that. It's very unusual. You just don't hear about that much at all. But it's a real possibility. It has happened. They have looked at the different types of epidural steroid injections head to head, and they haven't really shown a statistically significant difference between how well they work. But some people do believe that the transforaminal injection works better because it does get the steroid medication closer to where the actual pinching is occurring. All right, visit us online today at ArizonaPainNetwork.com. There's a ton of educational information on the site. You can see where our locations around the valley are, and there's a phone number as well to call. Our providers offer both medication management and interventional procedures, such as the 3 different types of epidural steroids. So thank you very much for watching.